Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and contents here on our YouTube channel. Also, you'll be able to support our community here at DamiRx Care. So let's jump right into the topic of choice today. So our topic today is a medication called Farxiga. So Farxiga is also known as Dapagliflozin, which is the generic name for the medication. So this medication is normally used in our diabetes patients in order to help manage their diabetes. It can also help in terms of their cardiovascular health, which is going to be their heart health as well in patients. So how does this medication work? So this medication works by working in the kidneys and reducing the reabsorption of that glucose that is going back into the blood. So it does this by reducing the amount of sugar or glucose that is in the blood system or blood vessels. So this medication is usually taken as a 5 milligram or a 10 milligram tablet once a day. It comes in a 5 milligram as well as a 10 milligram. So what are some of the side effects that you need to know about this medication? So some of the common side effect is urinary tract infection. So because of the way the medication works, it can cause some patients to have more recurring or consistent urinary tract infection. And if this become an issue, make sure you're raising that concern to your doctor. That way they can switch you over to another medication that doesn't have that side effect. So this medication can also cause yeast infection. So this is common in patients, especially female patients. So make sure that you're reaching out to your doctor as well. Also, this medication, because of the way it works, like I said, it works in the kidney. It can cause increased urination, which can later on cause increased thirst. And also, it can also cause low blood sugar, which is, kind of what we want the medication to do, but not too much of, lowering the blood sugar where it's actually not healthy for the patient. Also, this medication can cause low blood pressure because as we're losing those minerals that are going out, and including the glucose, the water is also being passed out, or liquid is being passed out along with it. So what are some serious side effects that you want to know about Farxiga? So serious side effect that you want to reach out to your doctor for, or your doctor might notice by doing your regular blood labs, is increased cholesterol. So if this medication start causing an increased cholesterol, make sure that you're reaching out to your doctor and, letting them know. Sometimes the doctor will be able to catch it on time. Also, usually in our patients with diabetes, they're already on a medication called statins, and this medication already is helping with lowering their cholesterol. So this side effect might not be too prone, but just in case if it start happening, they might have to take you off the medication. Also, another serious side effect is increased risk for bladder cancer. So in patients who have a history of bladder cancer, this is not a favorable medication, as this can also increase their risk or worsen that condition. So this medication's another serious side effect would be kidney injury or increased risk of fractures as well. So make sure that you're reaching out to your doctor. This medication is contraindicated, meaning this medication should not be taken in patients who have an end-stage renal disease or patients who have a kidney failure or patients who are on dialysis. So this is not a medication that it's going to be really beneficial in these patients because, like I said, this medication works in the kidney. And if your kidney has a very low function at that point, the medication is not going to be able to work as effectively as we want it to. So there's no point using that medication when the kidneys are already not functioning well enough to be able to perform as desired with this medication. So what are some other pointers that you want to know while taking this medication? So this medication is preferably taken early in the morning. That way, if you need to urinate, you're doing it during the day and you're not having to wake up multiple times at nighttime and, causing some sleep disturbance just because you have to go to the bathroom and pee a lot. All right, so this medication can also cause dehydration. So remember, you're constantly, peeing and, you're losing liquid, you're losing some electrolytes as well. So it can make the patient dehydrated. So if you're not able to keep liquid in as much, then this is probably not a favorable medication, because it's just going to increase your risk of getting dehydrated because you're not drinking plenty fluids to kind of, supplement for those liquids that you're, passing out or urinating. So what are other things that you need to know? So it is very important to monitor the blood level in terms of potassium, magnesium, as well as phosphate levels, because like I said, these are electrolytes that are being passed along when you urinate, and completely getting rid of some of this electrolyte can cause dehydration. And these are some of the labs that your doctor wants to take when you come in for an appointment. That way they can see and make sure that you're having optimum amount of those potassium, magnesium, as well as phosphate. That way you don't start having an increased side effect because you have a lower amount of these electrolytes. Also, like I said, it's very important that you're doing your quarterly A1C and going in for your appointment and getting your blood labs done or blood work done. That way they can see if the medication is working or seeing how your body's reacting to the medication. That way it's not like you're just using the medication and it's not really beneficial. So I hope I was able to help in terms of what to look out for while taking this medication. If you have any questions or concerns, please feel free to comment down below, or you can visit our website at www.demiarxcare.com, where you can talk to a pharmacist or consult with a pharmacist regarding your condition. Thank you for watching, and we hope that you stay tuned. All right, thank you. Bye-bye.